A patient who is 64, who has asthma, who has hypertension, and uses fluoxetide. Fluoxetide is known as fluticasone. What is fluticasone? It is inhaled corticosteroid, which is a must in asthma. And we have Concor. Concor, I hope that I'm pronouncing them right. Concor is a beta blocker. It is bisoprolol. So it is selective, blocking the beta 1. So normally when it affects the beta 2, it's problem for the asthma. But is this a problem? Right now, I think it's not a problem, but it can cause problem anytime. It's very risky because beta 1 can even affect beta 2. So instead of giving bisoprolol for the hypertension, we could just give the first line hypertension drugs like ACE inhibitors or ARB. I would say give enalapril, for example. But what is the real problem here? Hoarseness of voice, ulcers in mouth. So hoarseness of voice is normal. It's because of the inhaled corticosteroid. And ulcers in mouth is because of once you don't wash your mouth after using corticosteroid, you need to spit the water after washing your mouth with the water, then you can see ulcers, you can see oral candidiasis in your mouth if you don't wash your mouth. So what we're gonna do, we're gonna change what? We're gonna change or firstly Concor, this beta blocker. We're gonna change our hypertension drug. This Concor will be gone. Bye bye Concor. We're gonna give AC inhibitor like enalapril, let's say. And second thing that we're gonna change is actually the inhaled corticosteroid. This inhaled corticosteroid, why? Because yeah, maybe they just don't wash their mouth, but also even though they wash their mouth, sometimes it can cause ulcers. So we can give another inhaled corticosteroid, which is less likely to give ulcers. So in here, both salmeterol and theophylline can cause tachycardia, tremors, or headache. Or when you combine them, they can cause these problems together. By the way, I directly explained. So here, our 74-year-old patient has Ceravent. Ceravent means that this is salmeterol. Salmeterol is LABA and theophylline. Both can increase the risk of cardiovascular side effects. Both can affect the heart rate, increase the heart rate. Both can cause tremors and headaches. Once you see theophylline, by the way, you need to know that you need to be checking your blood because it has a narrow therapeutic index. Here, our patient has asthma and they are 50 years old. They are using Seretide. Seretide means it's a mix of salmeterol plus fluticasone. So this is short-acting beta agonist and long-acting beta agonist. And so this is long-acting beta agonist and a corticosteroid. I mean inhaled corticosteroid. This is fluticasone is inhaled corticosteroid. And here salmeterol is LABA, long-acting beta agonist. So if it's going worse, this asthma, it says that it's going worse, then it means that we need short-acting beta-2 agonist, which is for sudden attacks, for acute attacks, or also we should check the dose. Maybe the dose is not enough. And we can also add rehabilitation therapy. And we have here patient with asthma who is 53 years old, uses Ventolin. Ventolin is salbutamol and uses aspirin. So the biggest mistake here is using aspirin when you have asthma. Aspirin can trigger asthma. This is the problem here. We see bronchospasm, nervousness, restlessness, sleeplessness, and rash. About the rash is probably allergic reaction due to aspirin. Until it is prescribed, never take non-steroidal anti-inflammatory drugs with asthma. Aspirin causes all of those. Instead of aspirin, you could take something selective like celecoxib. I hope I'm pronouncing right. This one everyone knows.